educator of Raffles Hospital. I'm pleased to share the key takeaways of the ANCC NCPD Summit 2022 in Philadelphia with our chief nurse, Ms. Lillian Yu. Raffles Hospital has been awarded the 2022 ANCC NCPD Premier Award, the highest recognition by ANCC. On behalf of Raffles Hospital, Ms. Lillian Yu, Chief Nurse, attended the annual NCPD Summit on 12th of October 2022 in Philadelphia, US, and received this prestigious award. Every year, the NCPD Premier Award is presented to accredited providers who serve as role models and exemplars in the field of nursing, continuing professional development for a 2-year period. Raffles Hospital is the first private hospital in Asia to receive this award, and we are among a distinguished group of NCPD accredited organizations that have been carefully reviewed and conferred this award. This is a testament of our hospital's ongoing efforts to promote the highest standards of nursing and allows our nurses to enjoy continued professional development. Together with me is Chief Nurse Ms. Lillian Yu at the ANCC NCPD Summit 2022 in Philadelphia. These were some of the ANCC NCPD Summit highlights that were covered during the event. During the opening ceremony of the ANCC Minute Conference in Philadelphia, this keynote speaker, Colonel Nicole Malakowski, she shared that she was the first woman Thunderbird pilot, and accomplishments in her life, and also how she had gone through a difficult period of her life. Upon a medical retirement, she voluntarily altered recommendations to the Chief of Staff of the Air Force on how to improve the support of the Air Force's wounded, ill, and injured, specifically those patients enduring complex and chronic illnesses. Her own personal experience going through medical treatment process drove her to act on behalf of countless airmen enduring similar challenges. Because of her efforts, in an unprecedented move, the Chief of Staff of the Air Force directed the establishment of task force on support to airmen with complex medical conditions. In her veteran capacity, Nicole was appointed to this Air Force-wide effort, which resulted in dozens of actionable findings and recommendations currently being evaluated for implementation. She shared on certain key takeaways for us to learn. Pushing the envelope, being the best when it counts. So she shared that to be successful, leaders from every industry and experience level need to effectively navigate moments of self-doubt, master the role of a trustworthy team player, and embrace moments of personal and professional vulnerability. Using the idea of an aircraft performance envelope as a metaphor, this elite fighter, pilot, and military leaders shared inspiring personal stories and practical tools to unite individuals and teams to reach beyond their commonly assumed limitations and achieve their maximum capabilities and impact. Our next keynote speaker was Rebecca Love. She's the Chief Clinical Officer of IntelliCare, where she shared on using innovative quality data to drive professional development in nursing. Using this model to target the prevalent emergent issue that's happening worldwide with nurses leaving the profession every now and then. One of the many included the lack of a safe platform where the nurses' voices could be heard and the lack of work-life balance. Most often we hear of nurses suffering burnout due to the stress encountered at work from either patients or family members and work demands. Her team had worked on a retention model to manage clinical quality of a remote healthcare workforce, which promoted the NCPD. It tracked and investigated incidents and feedback received from the nurses and created a database of customer education for retraining, evaluating, and testing post-clinical incidents. They also developed a range of education models designed for adult learners to retrain the nursing workforce. So this is an area that which can take reference and address quickly and implement a cultural change among our nurses so as to be able to create a more sustainable future for our nursing profession, especially in our local setting. Our next keynote speaker was Rick Galdotti. He created positive exposure, and the session was titled Change How You See and See How You Change. He is an award-winning photographer who worked in New York City, Milan, Paris, and London for a variety of high-profile patients. and clients including YSL, Revlon, and L'Oreal. His work has been published in newspapers, magazines, and journals as diverse as GQ, People, the American Journal of Medical Genetics, The Lancet, Spirituality and Health, The Washington Post, Atlantic Monthly, and Life magazine. He developed FRAME, which stands for Frame Faces Redefining the Art of Medical Education, whereby it is a web-based educational library and resource created by Positive Exposure that changes medical information, how it's presented to healthcare professionals in their community. So this is one of Rick's artwork in Life Spread magazine, featuring a girl with albinism to bring out the beauty of her. Moving on was a sharing session done by Jennifer Grebe, Director of ANCC. She presented on the topic of learning in the absence of time, using outcome-based continuing education framework in developing educational activities for nurses. So this is a new conceptual framework that's needed to address how we learn and meet practice performance expectations. So OBC does not measure learning by time. It focuses instead on validation of learner engagement and performance, taking into account such variables like culture, resources, and institutional structure, as well as behaviors, values, and beliefs. So using this conceptual model for OBCE, it requires us to look at different aspects in the learning environment where it's driven to cause competence to take place and should make an impact on practices to improve and change. So there are 5 levels within the OBCE model that begins with the articulation of knowledge and skills and progress through application, demonstration, integration, and impact on practice, patient, and on all system outcomes. This model also acknowledges that learning is affected by individual or group behaviors, attitudes, values, judgments, and beliefs that can positively or negatively impact the achievement of desired outcomes. It also promotes a learning environment that's focused on the growth and development of a learner or learners. So in the above table, we can see the comparison using OBCE, educational design, and the traditional methods. An example using the OBCE is reflected in this example, where the 5 levels were inculcated. That includes the articulation of knowledge and skills and progress through application, demonstration, integration, and impact on practice, patient, and on all system outcomes. So this ability to get credit using this credit framework for the learning activity is a positive indicator. We had a chance to also explore the different exhibition booths during the MENA conference, and this is one of them. And we are so pleased to announce that we are among a distinguished group of NCPD accredited organizations that have received this prestigious award. These are the other recipients that have received awards for NCPD Premier Award 2022. We shared and presented on how RH had managed to achieve our distinction in ANCC by being able to meet the quality outcomes criteria to evaluate the overall effectiveness as a provider of CNE, how it has impacted us as an organization to share within the NCPD landscape. We are really thankful for our NED's team contribution and efforts that had made this possible together. And we are the only Asian hospital to have been awarded with this accolade. So in this picture, we are receiving the award from Jennifer Grebe. She is the director of ANCC, together with ANCC's president, Dr. Rhonda Anderson, and Chief Nursing Officer of ANA Enterprise, Dr. Debbie Headmaker. We're privileged to have connected with other international delegates of the NCPD Summit event from New York Presbyterian Hospital. So we would like to introduce this PACE model that was developed by Dr. Renedo in the previous picture. He was one of the directors of nursing that implemented this PACE model and written by him that was published that depicts the evidence-based practice process for clinical nurses. So this PACE model helps clinical nurses solve challenging problems through a rigorous evidence-based practice process from problem identification to evaluation and dissemination. And the crux of the PACE model is the mnemonic that simplifies the EBP process for clinical nurses. It's used across New York Presbyterian Hospital, one of the nation's most comprehensive academic healthcare delivery system. And NYP is composed of 10 hospitals in New York, employs more than 11,000 nurses across the enterprise. One striking advantage of this PEACE model is that it emerged from the work of clinical nurses who are struggling to find a way to remember and apply the components of the other EPB models. And this mnemonic piece promotes understanding application by them and also provides the uniqueness because of its simplicity. And this relevance leads to continued application in day-to-day nursing practice. During the ANCC conference, we managed to pay a visit to the various hospitals in Philadelphia and New York. So the first stop was CHOP, Children's Hospital of Philadelphia. The picture of us at Children's Hospital of Philadelphia. CHOP is the nation's first devoted exclusively hospital to the care of children, and it started off in 1855. It has been a birthplace for countless of breakthroughs and dramatic firsts in pediatric medicine. It was built on the foundation of delivering safe, high-quality, family-centered care, and the hospital has fostered medical discoveries and innovations that have improved pediatric healthcare and saved countless children's lives. And this is a view of the internal compound of CHOP. They have two hospitals within their network. One is in Philadelphia and the other one is right now in King of Prussia. Although they are all different in sizes and scope, but both hospitals they offer unparalleled care to children in their region and beyond. CHOP core values include integrity, compassion, accountability, respect, and excellence. This is Ms. Lila New, Chief Nurse, together with Ms. Larissa Hutchins, Director of Nursing, and Ms. Alicia, Program Manager of the Children's Hospital of Philadelphia. So in short, they have this Family Learning Center, whereby it provides a private, quiet environment for the parents and caregivers, and they can learn the skills needed to care for their children's needs at home. So they offer classes for both inpatient and outpatient families. Opened in 1997, it's named as Cornellis Center, and it provides a little children's library for the family as well, and a comfortable place to take a break. And this learning center is led by 6 nurse educators in providing patient education to the pediatrics patients every day. They have at different time slots and also is very family centered. We visit to CHOP's delivery suite and NICU. So as you can see here, the newborn babies are handled through the window to the stabilization unit for neonatal care. In CHOP, they do huddle procedures, which they will hand over the patient's conditions in a systematic order, as shown in the digital screen. And this provides a holistic approach for their patients. This is an example of one of the patient's room in CHOP. The next hospital that we have visited is MSK Cancer Center in New York. We also had a chance to visit David H. Koch Center for Cancer Care, which is located in New York City's Upper East Side. That is well known for its world-renowned faculty and cutting-edge technological resources, and this institute also drives research of clinical advances in cancer treatment from chemotherapy to targeted therapy to immunotherapy. This is a visit to their onco wards in Memorial Sloan Kettering, and here together is Chief Nurse Ms. Lillian Yu with their Senior Vice President of Nursing, Ms. Tracy Gosselin with the onco nurses. And this is a picture of David H. Koch Center for Cancer Care at Memorial Sloan Kettering. And it offers nearly every aspect of outpatient cancer care across many specialties so that most patients can get all their treatments in one place. We had a meetup session with Medical Director of MSK CC, Dr. Bob Lee, and Mr. Patrick, Project Manager of International Programs, and Ms. Elizabeth Rodingras, Director of Nursing, MSK CC. So as I've said, MSKCC offers nearly every aspect of outpatient cancer care among a lot of specialties, and is designed to help restore the patient's health and well-being that offers a variety of cancer treatments. The David H. Koch Cancer Center is situated facing the beautiful skyline and flowing rivers that was meant to serve its purpose to provide ecotherapy for the patients. research has shown that nature helps elevate mental stress in an individual and therefore the strategic location. The nurses and healthcare team, they actually also possess a RFID tag attached to the staff pass, and they can be tracked if they need to be contacted via the central system reflected at the nurses station. The rooms are designed with sleek design that's space conserving and technology savvy. Consumables are locked up in the cupboards with access card, and each room is designed with a digital board for the different kinds of precautions. So for patients who require a short stay, the center has a total of 16 rooms, private rooms with bathrooms and spaces for caregivers to spend the night. They have also a restaurant and also curated retail shop and a terrace to connect with the outdoors. Moving on, we moved on to New York and we visited New York Presbyterian Hospital, which is a world-class academic medical center committed to excellence in patient care. And they have a total of 8 campuses within their compound. This is a team picture with the Director of Nursing of New York Presbyterian. New York Presbyterian is also well known for being the center for patient safety research as it works to improve patient safety by developing solutions that are effective, replicable, and scalable. Showing you the entrance of the New York Presbyterian Hospital. We had a great experience where we could sit in for the MANEC meeting that invited international delegates from Estonia and London to share with us how their MANEC learning journey was. And it was really very valuable. And the next day, we had a nursing team that had invited us to sit in for the nurses' clinical retreat with the ground nurses to provide a platform for the team leaders to hear their voices and to promote autonomy and the nurses' professional development. And this picture is VP and CNO Rosin Russell of New York Presbyterian Hospital with Ms. Jen Watson, Site Director of Nursing, King's College Hospital London, and Ms. Lillian Yu and myself. So we had to go to sit in for the nurses' retreat, and we heard their voices on the challenges that they face in the wards. And they were discussing what are the targeted problems that they can seek to resolve. We also had learned of conflict management strategies that dealt with interpersonal conflicts, which are actually real-time issues. And we learned that open communication is definitely a key factor to communicate each other's thoughts and perspectives better, and to be able to clear the air in our working environments. And in the US, they promote the wellness of nurses very greatly, which is important because when we take care of ourselves better, we are able to improve our patient outcomes as well. So we also had learned strategies of how to self-care for ourselves better. So we were privileged to be able to attend the ANCC National MANEC Conference and also manage to browse through the poster exhibitions done by the international nurses all over the world. The following are some examples that we have presented on the latest evidence-based practices. The first one was by Houston Methodist Raffles Hospital. They shared on the fall prevention program. So they have this falls huddle that was introduced to the unit's shared governance council to educate patients on patient safety and fall prevention. The innovative and integrated approach to falls prevention includes they did rounding on all the 36 patient rooms, but charge nurse at the beginning of each shift, and to make sure that all the measures were put in place. There are measures like bed alarms, 4 mats applied, beds hooked to the call bell system, the belongings and call bell within reach. If there was deviation from the above, the charge nurse would inform the primary nurse and the assistant responsible for the patients, and they will collate all these findings, and the charge nurse will write an audit form to submit to the manager. And afterwards, the manager will take appropriate action on the findings. In Houston Hospital, they are using the Hester Davis Falls Assessment every shift by nurses, and it's recorded in their patients' charts to ensure that everything is in place properly. So there's also care zoning where RNs and nursing assistants were assigned and responsible. Another poster depicted of a way to stop Class B infections, which is central line associated bloodstream infections. So the purpose of the project was to reduce Class B cases by 50% within 6 months of implementing the use of clear gut HD caps on all HD catheters in a post unit. In August 2019, this unit collaborated with Infection Control and Clinical Practice Education Department. They used a Plan Do Study Act or PDSA methodology to target Class B reduction in HD patients. And following literature research, they had selected HD caps, clear gut HD caps for a 6-month pilot project. Clear gut HD is a disinfectant cap that features a rod coated with cloxidine that extends into the catheter lumen and dissolves in a catheter lock solution to kill microorganisms. Moving on, UPMC talked about reducing MRSA rates in their neonatal patients. As we know, MRSA is a bacterium with antibiotic resistance, and neonates being low in immunity, they are a vulnerable population. So therefore, in the NICU, there was such an increase in MRSA prevalence, and therefore our multidisciplinary team was formed to review these current practices and evidence-based practices to decrease the prevalence of them having this colonization. So in conclusion, the poster reflected the collaborative efforts of their team that allowed them to significantly reduce the rates of prevalence and new incidences of MRSA in NICU. So some initiatives that they did was weekly surveillance, screening for MRSA, monitoring compliance for hand hygiene and up and away, and monthly NICU patient safety committee meeting. In the US, they focus a lot of self-care. And as you can see from this poster, it says nurses who are kind to themselves have healthier behaviors and report less work-related stress. So they were saying of how self-compassion can aid in nurses' well-being, because many nurses lack healthy behaviors according to their research and have stressful jobs causing compassion fatigue. So it reflects that nurses who are kinder to themselves have healthier behaviors and report less work-related stress. Moving on, by UVA Health in Virginia, they publish a method and strategies that they use to retain nurses in the hospital. So here are some of the things that they have developed to retain nurses. One of which includes mentorship programs, where it is a consistent framework that's driven by nursing governance under their shared governance council. So this actually helps to mentor the nurses who are new to the ground, and it provides professional networking and support from the various clinical areas of leaders. Another hospital, Penn Medicine Pennsylvania Hospital, has a similar mentorship program, which formally connects all the nurses to identify mentors in their career journey, and this helps to build up their professional growth. Some add-on strategies are the above, and they even have Daisy Awards to award their nurses and to promote recognition and to hone nursing professionalism within the community. One of the posters, as shown over here, is using innovative staffing methods that was used during COVID season. As we know that during the COVID season, it has been a stressful moment in the pandemic. So therefore, they had to cross-train employees and send for staff redeployment throughout the organization. So before they did so, the employees were asked to self-identify their levels of competency based on institutional standardized scale. And they realized that cross-training employees strengthen their skills and competency and adapt to the workforce, allowing the organization the ability to redeploy staff based on various needs. So they had used team nursing, which was the primary care delivery model that was adopted to boost the clinical support of the highest acuity patients in ICU. The staff also gained a greater perspective of hospital operations and appreciated the opportunity to work in another's shoes in areas outside of their home department. And they had flexible shift hours, also allowed redeployed staff to provide assistance at times that work within their own schedules, and also provided care teams during busier times, meal times, and high numbers of patient discharges. Next, we have this trial of using the tiered skills acquisition model that resulted in elimination of orientation extensions for new graduates. So because there was an incline in the number of new graduates in 2021 to 2022 in their clinical area, so the trend observed that the new nurses were not reaching the full patient assignment until the final weeks of orientation. and it was affording little exposure and experience to a full patient assignment. So therefore, they use this TSAM model, whereby it allows the RNC to be assigned to one patient and progresses by increasing the patient number. So TSAM is based on Dr. Banner's, Patricia Banner, novice to expert theory. And in TSAM, the RNC takes full patient assignment with preceptor from day one and gradually assumes increased role responsibilities based on advising through tiers of skills. Preceptors can advance RNTs based on their demonstrated level of competence. Although the RNT will only be responsible for parts of patient care, he or she could still be engaging in practicing tasks when the opportunity arises. And this is a schedule of one of the preceptor courses developed by Penn Medicine, where they focus on adult learning principles and learning styles of preceptees and addressing strategies to apply critical thinking skills and time management skills in goal planning for the patients and work. Another poster did by TriCare also featured on how to take care of nurses' well-being, because nurses reported experiencing stress which impacts job satisfaction, burnout, and turnover, high turnover. So the nurse leaders are a unique group whose stress impacts themselves, the nurses they serve, and patient care. So experts have advocated that one approach to reduce this stress include person-centered strategies, arrive at coping strategies. There have been no studies examining the impact of person-centered interventions on improving nurse leaders' engagement and ability to cope with stress. However, the nursing leaders were provided a positive thinking skills training bundle, which included a 1-hour positive skills training class that focused on 8 positive thinking skills and 5 daily activities to promote positivity. They also received daily affirmations on a platform. And in this last poster, it shows of how the nurses improve well-being in acute nurses care setting post-pandemic. So nurses were found to have experienced burnout, one of the highest contributors to nursing turnover rates, especially during the pandemic. It is normally contributed by poor well-being of the individual. This study focused on methods to decrease the level of burnout and increase the well-being of acute nurses by instituting a well-being educational initiative within the organization. So in this organization, they had this Wellness Wednesday activities and using social media platforms to promote the wellness activity programs. And it helped acknowledge the strategies employed to improve their well-being. And it not only improved the scores, but results have shown that it's not significant. Thank you.